This is an overview of an article entitled Circulating Branched-Chain Amino Acids and Incident Cardiovascular Disease in a Prospective Cohort of U.S. Women, published in the April 2018 issue of Circulating, Genomic and Precision Medicine. Circulating branched-chain amino acids, or BCAAs, include isoleucine, leucine, and valine. They've been identified as strong predictors of type 2 diabetes mellitus, but their association with cardiovascular disease, or CVD, is uncertain. Few prior studies have conducted targeted prospective analyses of BCAAs in relation to incident CVD events, although what data do exist from such analyses and from unbiased metabolomic discovery studies suggest that there is a relationship. Accordingly, the authors of the paper under discussion hypothesized that higher baseline levels of plasma BCAAs would be associated with an elevated risk of incident CVD events. They also hypothesized that the BCAA-CVD relationship would be related to shared cardiometabolic risk pathways, and evaluated whether this relationship was dependent on an intermediate diagnosis of type 2 diabetes. They conducted a prospective targeted analysis of BCAAs in relation to incident CVD in 27,041 apparently healthy U.S. women in the Women's Health Study with greater than 18 years of follow-up for incident CVD and type 2 diabetes. And they examined whether BCAAs were associated with CVD independent of their association with incident type 2 diabetes. CVD events were defined as first confirmed non-fatal or fatal myocardial infarction, or MI, stroke, both ischemic and non-ischemic, or revascularization via coronary artery bypass graft surgery or percutaneous coronary intervention. When defined in such a way, there were 2,207 women with incident CVD events. All of the participants had single measurements of plasma BCAAs by NMR spectroscopy using their baseline blood samples at the start of the study. The authors assessed for associations between total BCAAs or individual BCAAs and incident CVD events, with some models being multivariable adjusted for age, body mass index, smoking, diet, physical activity, and other established CVD risk factors. To assess whether any associations were linked to cardiometabolic risk factors, they further adjusted for the biomarkers of insulin resistance or dyslipidemia shown on this slide. Here are the primary analyses with total BCAAs and total incident CVD events, showing associations with strong statistical significance even after multivariable adjustment, and secondary analyses with individual BCAAs and or individual types of CVD events, where the associations are typically weaker, especially for stroke. Even with the primary analyses shown in the upper left part of the table, it might seem as if the hazard ratios per standard deviation are small. However, to put this in context, it's worth noting that if one does similar association analyses with LDL cholesterol and incident CVD events in this same cohort, the hazard ratios are very similar to those seen with total BCAAs. Here, the authors stratified the analyses for individuals with no diagnosis of diabetes versus those diagnosed with diabetes prior to the first CVD event. The associations were substantially stronger for women with prior diabetes, although it's worth noting that in women without diabetes, for total CVD events, the association with total BCAAs was still statistically significant. Also worth noting, though not shown here, is that an analysis of the effect modification by diabetes status with respect to total BCAAs and total CVD events had a significant p-value of interaction, 0.036. The authors performed several additional analyses. They assessed whether addition of total BCAAs would improve the ability of a multivariable model to predict incident CVD events. They found that the receiver operator curve, or ROC, significantly improved with respect to its area under the curve, or AUC, from 0.718 to 0.721. Although this might seem small, when a similar analysis is done with LDL cholesterol, the AUC improves from 0.718 to only 0.719. In a separate analysis, the authors assessed whether adjusting for cardiometabolic risk factors weakened the associations. Notably, adjustment for biomarkers related to impaired glucose metabolism and insulin resistance, including hemoglobin A1C, LPIR, glycosylated acute phase proteins, and triglycerides, completely attenuated the associations. In contrast, adjusting for LDL cholesterol, HDL cholesterol, or high-sensitivity C-reactive protein had little effect. These findings suggest that the relationship between BCAAs and CVD can be mostly explained by more downstream biomarkers of type 2 diabetes metabolism. In conclusion, the authors showed that circulating plasma BCAAs were positively associated with incident CVD in a prospective cohort of U.S. women, especially in women with type 2 diabetes prior to a CVD event. Impaired BCAA metabolism may represent a shared pathway of the metabolic pathophysiology that links the risks of type 2 diabetes and cardiovascular disease. Finally, future research investigating the modifiability of BCAA metabolism with reduction of subsequent disease risk is warranted to understand the role these metabolites may play in clinical practice.